thank you. We'll get started with the Clinical Pearls abstract session to make sure that we get out to enjoy the weather. We're excited for our 9 presenters who've all put in a lot of work and are working hard to make sure that you all get a chance to hear them. So our first speaker is Dr. Tim Chang from Mayo, and he's going to present his abstract on complications with new oral anticoagulants.
Good afternoon. My name is Tim Chang. I'm a first-year dermatology resident at Mayo Clinic in Rochester. And it's a privilege and honor for me to be able to present to you some of my research on complications with new oral anticoagulants, Dabigatran and Rivaroxaban in cutaneous surgery. I'd like to thank the other authors that have contributed to the study, especially Dr. Clark Otley, who has supported me throughout. I have no disclosures. So first we'll look at the background of new oral anticoagulants. There we go. All right. So first we'll look at the background of new oral anticoagulants. Then we'll look at the design of the project and some of the results and conclusions that we were able to see. So as far as the background of this study, new oral or anticoagulants in general have not been associated with severe life-threatening complications during cutaneous surgery. This has been evidenced by many studies that have been performed, a few of which have been done at our own institution, looking at aspirin, warfarin, clopidogrel. However, stopping these medications during cutaneous surgery has been associated with severe thrombotic complications such as strokes or MIs. So looking at these new oral anticoagulants, Dabigatran was FDA approved in 2010 and Rivaroxaban in 2011. Interestingly, Dabigatran is the first novel oral anticoagulant since warfarin over 50 years ago. So looking at the coagulation cascade, we can look at the mechanisms of these medications a little bit more closely. Dabigatran is a direct thrombin inhibitor, and Rivaroxaban is a direct factor Xa inhibitor. Both of these are indicated for atrial fibrillation and stroke prophylaxis. Dabigatran is also indicated for DVT and PE treatment, and Rivaroxaban is indicated for VTE prophylaxis in some orthopedic surgeries. Some big advantages that make these medications very appealing to patients are that, first of all, they're oral, as opposed to many of the anticoagulants on the market that are injected. It's simple once or twice daily dosing, and most importantly, there's really no accurate lab monitoring and no monitoring required for these medications to date, and so they don't have to get INR checks like with warfarin. Some disadvantages are that to date there are no specific antidotes for these medications. As far as Dabigatran is about 35% protein bound and may be dialysable but needs further studies, and Rivaroxaban is not expected to be dialysable since it is mostly protein bound. So there's no real published data on these medications in cutaneous surgery, and of course patient safety is of the utmost importance. So we sought to do the first study looking at these medications in cutaneous surgery. So we'll talk about our design a little bit. IRB approved. We looked at all patients that underwent Mohs micrographic surgery or basic excision in our dermatologic surgery suite at Mayo Clinic while they were taking Dabigatran or Rivaroxaban between 2010 and 2011. This was a retrospective analysis. Case controls were planned but not used because there are a low rate of complications, as we will get into. So looking at our results, first tackle Dabigatran first. We found 27 patients that underwent 41 cutaneous surgeries. We only found one complication among all these. Here's a compilation of all of our patients, and we'll look at patient number 20 a little bit more closely. He's a 73-year-old white male who was taking Dabigatran 150 milligrams twice daily for atrial fibrillation and stroke prophylaxis. He was also concurrently taking baby aspirin. So he had a right cheek BCC that was treated with Mohs micrographic surgery. It was cleared in 2 stages and repaired with an intermediate layer closure. The complication that he had was intermittent bleeding from the site for about 2 days after his surgery. It was not relieved with pressure at home. So we had him come back into clinic, and we applied a good pressure dressing, and that achieved hemostasis. Ultimately, there were no severe complications observed. As far as Rivaroxaban, there were fewer patients because this is a newer drug on the market, and we found 4 patients that underwent 5 cutaneous surgeries, and there were no complications observed. So as far as our conclusions, we found that there were no severe life-threatening complications with these medications during cutaneous surgery. And given the potential for severe thrombotic complications with stopping anticoagulants, as we have seen in the past, we recommend continuing these medically necessary anticoagulants in cutaneous surgery. As far as future studies, retrospective case control studies will need to be performed, as well as looking at Dabigatran plus aspirin versus Dabigatran alone. And Apixaban is one of the newer kids on the block that is similar to Rivaroxaban, FDA approved in December of 2012, and that will need to be studied in the future. Thank you for your time.